We are live. So welcome all to Keeping Up With Cosmedicare episode 3. This is a series which has been designed to showcase the healthcare treatments and surgical treatments on offer at Cosmedicare for men, women and the transgender community. So tonight we are on with two absolute experts and we are talking all about facial surgery. So I asked in the group couple of weeks ago if anyone in the community had any questions relating to facial surgery, and we got some really great questions in. So thank you for anyone who took the time to write in, and please be reassured no names will be mentioned. It's completely anonymous, and actually emails get deleted as soon as they come in, so that should hopefully put anyone else's mind at rest who's thinking about getting in touch for future episodes as well. So as I mentioned, we're joined by two absolute pros. Many of you will already know and love Jill Baird. Hello, Jill.
Yes, hello, Laura.
Hello. So Jill is super active in the GGC community, which is always lovely, but Jill is the managing director of Cosmedicare and is one of the only women that I know that's got MBA in her title, Jill.
Well, thank you. I might get rid of that though. It's starting to sound a bit.
Oh no, please don't. I love it. And for anyone who hasn't watched episode 1 of Keeping Up With Cosmedicare yet, I know that thousands of you actually have from the stats, which is amazing, but I would recommend that you do, because it's a no holds barred chat with Jill, who is very open and honest and talks about the ups and downs of life, the challenges she's faced from being expelled at school to being the first female to found and run a cosmetic surgery brand in Scotland, and is now, 5 weeks away, Jill, from opening a fully funded, state-of-the-art, multi-million-pound private hospital.
I know, it's crazy. It's 5 weeks. It's a blink away now. I can't wait.
So I think I speak for everyone when I say on your cell, Jill. For sure. Now we are also joined, Jill, this is the second time that you've brought a man into our group.
Yes.
But we do forgive you because Dr. Will Anderson, you have got an amazing array of credentials, which I'm actually going to read out, because part of the messaging in this series is very much so that regardless of who you get a treatment from, where you go, make sure you do the research on your surgeon or your aesthetics practitioner. Make sure you know their qualifications. So I'm going to read this out. Well, I'm going to hopefully I'll get it right and I can read all the words right, but let's go from the top. Right, okay. Will Anderson is one of the top consultant plastic, reconstructive and aesthetic surgeons in the country. A fully trained microvascular surgeon, he provides genitoperineal reconstruction and is the clinical lead in the laser department at St John's Hospital. His microvascular skills include providing mastectomy reconstruction using patients' own tissues, and he performs all aspects of aesthetic breast and body surgery that can help restore patients both physically and psychologically. Like many plastic surgeons, he's also involved in the management and reconstruction of burns, trauma and skin cancers. Will also provides aesthetic surgery of the breast and body and surgical and non-surgical rejuvenation, and is the lead plastic surgeon for gynecology for the East Coast. On your cell, Will. So that is quite the mouthful, but really important to read it out because
that didn't cover the facial aesthetic surgery that I do either.
Yeah.
That's what
Brilliant. Okay. Fantastic. Right. So before we get started, I know a lot of you will be looking forward to getting onto these questions. A few more things that I want to cover. So Keeping Up With Cosmedicare, similar to the Glow Live, is all about bringing you lovely lot information, entertainment, because we always say that knowledge is power. As with everything you see in the GGC, as a consumer, exercise your power, do your research. There's always alternative options, so know what your options are. And also, just to add that this series is part of a carefully curated paid for partnership, but we like to see it as win-win advertising, because we can actually get all the community involved who want to find out about a topic, and they're under no expectation or pressure to make a purchase. So I think I've covered everything off, guys.
Yep, you have.
Will we get right tore into the questions then?
Tore in, love it.
Tore in. Right, okay. So we've got them. They came in with like different areas of the face. So I think it's quite good to probably read out the questions like that. So our first question came in, and it's about these questions are about the nose. When it comes to nose surgery, what is the extent of what can be done? That was the first question that came in.
Where do we start with that one? The nose is a key feature of the face, obviously, and what surgery is required to change a nose to a more desirable nose can range hugely, and that cuts into kind of reconstructive surgery of the nose, which we sometimes have to undertake when there's been cancer resections, to minor surgery to help refine or change the appearance of the tip of the nose, to more major surgery that can involve completely altering the bony and cartilaginous architecture of the nose to reshape the nose completely. And it's trying to get the expectations of the patient aligned with what you can deliver. And that's not always the case. And certainly with rhinoplasty surgery, it's well recognized to be one of the operations that we do that has the highest revision rate. And in terms of satisfaction rate, it certainly doesn't rank highly of all the procedures that we do. And that's because inevitably it's an area of the body that you are constantly scrutinizing. So it can be very challenging surgery indeed. And every time it needs to be bespoke, the plan of action, getting to know the patient, understanding what their expectations are, so that hopefully you can deliver so that you get a happy patient. And there's no doubt in my mind, certainly with aesthetic surgery, one of the key endpoints for me is if you can make somebody happy with the outcome of surgery, that makes it all worthwhile, really.
Oh, absolutely.
Laura, that as well is we get a lot of inquiries for rhinoplasty surgery. And when Will's talking about revision rates and things, that's industry-wide. It's not as an individual plastic surgeon. I've spoken about this on previous lives with Dan, and even before Dan as well. There are surgeons that sometimes they just don't do rhinoplasties. They might do other aspects of the face, they might do breast, they might do body. Then you get maxfac surgeons that only do the face, but it doesn't necessarily mean that they are the best people for doing a rhinoplasty, because there's lots of different aspects, like Will said about the nose. There's the functionality, the breathing aspect, which is usually cared for by an ENT surgeon. And then maxfacs come in and they get involved in reconstruction and things with that, usually if there's been some sort of trauma. But the people that probably do the most rhinoplasties are plastic surgeons who have decided that they're going to develop their skill set within that area of the face. And it's not uncommon to have surgeons, particularly down in England, who only do rhinoplasties, they don't do anything else. So it's really important that you do your research into a surgeon, and at any point with any cosmetic surgery, with any surgery at all, if in doubt, don't just stop, because you can revisit another time. It's really, really important to get it right the first time, because as I'm sure Will will tell you, the revisional rate is quite high for rhinoplasty surgeries, and the more you go in and mess about surgically in that area of the face, things disintegrate. And that's how you see things like Daniela Westbrook, Michael Jackson, the celebrities whose noses have distorted into unrecognised abnormal type of results. And what's aesthetically pleasing to one person isn't necessarily the same as another person. So when we're looking at selection, I tend to my first point of call when someone submits images and things is, if first and foremost, if we can't see anything that we can improve, we try and discourage that patient from doing anything at all, or look at surgical options, which Will's in a really fortunate position that he can do both. He can do surgical and non-surgical. So he's able to advise the patients independently of what might be the best option for them.
Brilliant, because that actually was one of the questions that came in relation to surgical versus non-surgical. So would you recommend going down the dermal filler route first to smooth out a witch-like bump in my nose before taking the plunge and going for a nose job? How would the results differ between the two?
There's a limitation to what can be achieved with, certainly with abnormalities on the nose. And fillers are a very good way of trying to address those, and sometimes they can be very effective. And sometimes it can be actually very long lasting. One of the advantages of certainly the fillers that I would tend to use, which is the hyaluronic acid fillers, is that they don't last forever. And if they aren't quite as we would like them, they can be dissolved with an enzyme, albeit the enzyme can create an allergic reaction in a very small number of people. So for minor abnormalities, it can be an alternative, it can be a realistic alternative to open surgery. And it also can be a useful adjunct for minor imperfections post-surgically. But it's certainly not a substitute for the majority of people that are desiring, nose altering surgery, because it just will not achieve the results that they're hoping for.
Yeah, and on that as well, obviously you said I'm really active within the Glasgow Girls Club. I'm a Glasgow girl myself. I love supporting other women in business, and I see lots of people offering rhinoplasty filler and things like that as well. And Frances Turner Trail, we do a lot of work with Frances. She's excellent at non-surgical rhinoplasty as well. But I think when it gets around this area of the face, the vascular construction of the face and things makes it really important that you get someone who knows exactly what they're doing. Yeah. Things can go very wrong very, very quickly around this particular part of your face.
That is very true.
Can dissolve things, but you can have reactions to that as well. So it's really important with your research and you go to someone who does this regularly. And if they're medically qualified, that's really where you want to be going.
Okay, brilliant. Okay. Next question then. I've hated the bump in the bridge of my nose for 40 years. I'm ready to make a change, but I'm terrified of doing anything that will make it look worse than I think it is at the moment. Is there any way to see a visual of how my nose shape will likely be after the procedure, and how long is recovery, please?
Well, at Cosmedicare, we've got a three-dimensional photographic imaging system, something called Chrysalix. And Jill is a bit of a whiz at using it. We use it for a whole variety of different indications, including changes to breasts, for instance, but it can also be used for manipulating images for rhinoplasty work to give an impression of what the post-operative results might look like. So that can be quite helpful. And, there's no substitute for coming and having a consultation and getting the opinion of a rhinoplasty surgeon so that they can give you a realistic expectation of what the recovery is going to be like, because it may differ depending on what's required.
Okay, that makes sense.
One of the things that differs in our patient pathway for rhinoplasty patients as opposed to other surgeries is, I've spoken before about how we do telephone consultations first and foremost via images sent to the surgeons for them to give patients advice on what's potentially available to them, what their options are. That's always followed by a face-to-face consultation, and these are about half hour each. But with rhinoplasty patients, we get them back for a further consultation, and our cooling off period pre-COVID was always longer for the rhinoplasty patients than it was for other patients, which is usually the cooling off period that's recommended by the GMC and a lot of the governing bodies is 2 weeks. Okay. But with plasties, we really encourage people to take a lot longer thinking about it. One of the things the guys do in consultation, they use the Chrysalix, but they also sit with a mirror with the patient, looking at the whole aspect of the face, and they draw things. It's quite an in-depth consultation, and that really comes back to why communication is the key point between a patient and a surgeon about expectations and what's realistically achievable.
Yeah, no, absolutely, absolutely. Okay, brilliant. Next question. I am a female in a man's body. Is there anything that can be done to make my nose look more feminine as part of my gender transformation journey?
Well, I think that's certainly likely to be the case, and it will depend on how masculine the nose is to start with. But there are certain features that can be more feminine, and certainly rhinoplasty surgery can be tailored to make the nose look more feminine. Obviously, it's not always a desirable outcome of male rhinoplasty, but certainly in this group, there's no doubt it can be undertaken to make the nose more refined, more petite, less prominent dorsum of the nose, to make it look more feminine.
Okay, brilliant. Okay, and this is the final question with relation to nose. So I underwent a nose job a few years back when I lived in England, but honestly, I have never been satisfied with the results and was too scared to say at the time, I think my nose looks unnatural. Is there anything your team can do? Appreciate you would need to see it, but thought I would ask first.
Absolutely right. We would need to see her to see what the situation is. But as we said earlier on, revisional surgery is never as straightforward as the primary surgery. So getting a primary surgery to try and meet your expectations is the key. But there may be things that can be done.
Okay.
Well, if anyone is thinking about this and they're Googling things, it's known as revisional surgery. It doesn't necessarily mean that you're having a revision with the original surgeon. It's just of an initial result. And it can also be known as secondary surgery as well. So if you are looking for that, you're looking for someone who does these and who does them regularly. You don't want someone who does maybe not an awful lot of rhinoplasties trying to do a revision of a previous rhinoplasty that's complex. That's just asking for trouble. Yes,
that is definitely asking for trouble. Right, okay, brilliant. Okay, so we're going to move on to ears. So the first question is, my boyfriend has the worst cauliflower ears from rugby. Is there anything that can be done?
I wonder if the boyfriend is worried about his ears.
I know he might not know this question's been posed, but we're all excited to the answer.
I suspect it's a badge of honour amongst rugby players and MMA fighters. But there are things that can be done. Clearly, it's best to be left until the rugby career is finished. But essentially, cauliflower ears are the result of recurrent trauma to the ears. What happens is when the ear, and you see it with the MMA fighters as well, when the ears get traumatized, what can happen is you can get bleeding that occurs just under the layer that covers the cartilage of the ear, and that produces a very painful blood swelling. It's the pain subsides, but ultimately that blood can be can leave a permanent distortion and a lump. It can even become calcified, and you can get this cauliflower ear deformity. And there are things that can be done. Certainly, the skin can be very carefully lifted off from the underlying cartilage and the areas that are producing these deformities, and the ear can be almost carved back to its original shape before the skin's carefully laid back again. So yes, there are potential surgical options to help. It is a preventable deformity. If when you get a very painful blood swelling on the ear, if it is drained at the same time, you will generally avoid the cauliflower ear deformity. But it's not something that's readily done amongst rugby players and fighters.
They seem to not like going to hospitals unless they absolutely have to.
Yes, yeah. Do you know what? That's so interesting, because I've always wondered about cauliflower ears.
How does it happen?
Yeah, how does it happen, and is there any going back after it? So that's really interesting.
We've had like Will was saying as well, the MMA fighters, a few quite famous ones as well. And they're the nicest, sweetest guys. Their girlfriends tend to bring them to Cosmedicare, and they've literally had their pulled so far inside their head, and you think that must have been so painful. So,
but they're just strong guys. Okay, that was a really interesting one. Okay, next question. My ears are big and stick out. My nickname was Dumbo, if that paints a picture. What types of surgery can be done to help a girl with ears that have eroded her confidence over the years?
Oh, there's everything that can be done. She is not alone, and it's amazing just how certain facial features, ears, noses, can erode your self-confidence. And children are absolutely ruthless when it comes to teasing at school. The shape of the ears is predominantly dictated by the cartilage and how it's shaped, how it's folded, how it projects from the side of the head. So any surgery that we do to correct prominent ears is directed at trying to reshape the cartilage and help to pull that cartilage back further against the side of the head to try and give a natural looking ear that doesn't look as if it's had an operation, but is much less prominent. And that can be tailored, and it's very much, again, a bespoke operation. And whilst we use similar techniques for many otoplasties, sometimes we need to employ techniques to very carefully resect a section of cartilage to allow the ear to come back. We can use sutures into the cartilage to help accentuate folds. We can use sutures to recess the bowl of the ear back against the side of the head. All of these things are techniques that can be used. There's a more commercial device called an ear fold, which people may have read about, which is almost like a staple that tries to fold the cartilage where you want it to fold, but it's a very one-dimensional type approach to ear correction, and I don't tend to use that. Essentially it's tailoring the surgery to exactly what the deformity is and how flexible the ear is, how nicely it will fold and change shape with sutures and with recessing it against the side of the head. And it can be done under local anaesthetic. It takes about between 1 and 2 hours to do that.
Okay, brilliant. So
the pinoplasties, Will does a lot of pinoplasties. Will and 2 other of our surgeons do a lot of pinoplasties, and again, it's one of those ones where it's really about managing expectations, because what I've found of managing patients through these processes, is like the girl said, she's got trauma from childhood, and people say things, and they usually won't wear their hair up because they don't want anyone to see anything. So when you initially get this surgery done, your ears are literally pinned back to your head like something from Star Trek, so you can't see your ears. As they heal, they will retract back out again. And I think a lot of people really panic that they're going to regress right back to where they come from, and it takes a wee bit of time for that to settle. But what you really, what I try and do, and I know that Will and the surgeons do this in consultation as well, is really manage the expectation of what a normal ear projection looks like.
Yeah.
I mean, you put people in saying there's a difference between the 2 ears, and there's literally 2 millimeters. So if you take a ruler and measure the 2 millimeters, the people have been through so much trauma and they're so self-conscious about their ears that they're measuring to the millimeter. It's like your boobs. Your face is never perfectly symmetrical. You're never going to get exact symmetry. So again, it's one of those things you really need to think about what you're doing before you do it, and be able to commit to the aftercare, because the aftercare is really, really important with the pinoplasty procedures.
Okay, and that's really interesting. It's local anaesthetic. You wouldn't need to
potentially.
Yeah.
Some people run a mile. It doesn't anaesthetize your hearing, so you do hear things going on, but usually there's chat and the radio playing. It's usually a fairly calming environment.
Yeah.
And with the nose that we were doing before, would that be general anaesthetic, just in case anyone's watching and wondering?
Yes.
Okay. Okay, right, brilliant. So the next question is, my daughter has those loop things in her earlobes which stretch them. She asked me the other day what she should do if she was to take them out, and then I seen this program promo post and thought I would ask, can you help?
Yes, we can certainly help, and we do quite a number of these what we call tribal piercings with the stretchers that have elongated the lobe. Often it actually generates more lobe tissue than there was before. So it's certainly possible to essentially remove that hoop of earlobe and reconstruct a more reasonable and natural looking earlobe. There's inevitably some scarring at the site of the surgery, but it can restore a much more normal looking ear. And again, that's something that lends itself to being done under local anaesthetic. It takes perhaps an hour to do 2 sides. there are small risks with all these operations we've been talking about, and certainly for the ear, one of the small but unpredictable risks is for scars to misbehave and become overactive, and you can get a condition called keloid scarring, where the scar really goes into overdrive, and you get a very large lump of scar potentially forming. And the ears is one of these sites that has a predilection for that. It's still only about 1 in 100 people, so it is pretty rare. But if it does happen, it can be a real nuisance because it can require additional treatments, sometimes even further surgery. But it can be very difficult to get it to settle itself down. That's something always to bear in mind. But again, tribal earlobe repair is, and again, it's a bespoke operation. You work with what the deformity is to restore normality, essentially.
Yeah, because some of them are small, aren't they? But some of them, you see them in their massive.
Yeah, absolutely.
Yeah.
On that stage, whilst we're talking about earlobes, there was another thing, and I don't think anybody's asked it. It might be because of the age demographic of the people that are in the group, but we do another form of lobe surgery as well, which is lobe reduction. So a lot of the time, as people get older, and you tend to see it more in males, the lobe stretches and their ear looks as if it's, but it's really the lobe that has elongated. That reduction for that, and
it's a sign of wisdom, Jill.
Yes. That often.
Unfortunately, my earlobes are very small, I think.
And the thing that I don't think anybody asked, but whilst we're on the topic of piercings, we experienced with a patient, everything stays confidential, but we had a lady who travelled quite some distance because she'd had those piercings put in your ear. It's like the stars. I can't remember what it's called, but it's like the formation of the stars. You have it pierced into your ears.
Okay.
Lovely young woman. She'd had these piercings in a professional setting, a sterile environment. She'd done everything right. And she took her reaction to them, and cysts grew. Completely deformed her ear. We found she was in a newspaper, and somebody commented and said, "Oh, Cosmedicare might be able to help you." So we did it as part of our Cosmedicare trust, and Will was her operating surgeon. But there are things that can be done, and a lot of people, they won't come forward because they think if it hasn't been offered in the NHS that it's potentially, there's nothing that can be done, it's not available. That's not always the case.
Yeah.
So worthwhile for people to know that that's an option, whether they want to pursue that down the NHS or look at it privately. There are options as well.
That was keloid scarring that lady had, which can occur at piercing sites. We see quite a number of patients, both on the National Health Service and certainly in Cosmedicare. We've seen some too.
That's really interesting, and good to know that, you might as well ask the question. Just ask if anything can be done, if there's something that's affecting you. Right, okay, brilliant. So the last question on ears: are you left with scarring on your face if you get a procedure done on your ears? Where's the scarring, and what's like the recovery time for?
Well, my typical post-operative management would be for a full ear correction, I would tend to put a very well applied padded dressing and a bandage around the head to help cushion the ears, and that stays on for between 5 and 7 days. Most people will want to be working from home or not be going into the office during that time, and the same is true if it's children and they tend to take the week off school. We then bring you back, because I tend to use a suture that runs underneath the skin that we snip, and it just slides out about a week later, so that I'm not leaving much in the way of suture material in the scar itself, which is tucked away behind the ear, in an effort to try not to stimulate any additional scarring than an absolute minimal response, because what we don't want to do is try and encourage this keloid scar formation. Now, after the bandages are removed at a week and the sutures removed, there may be a little bit of bruising. The ears are often a little bit sensitive. We tend to recommend using a kind of broad, comfortable headband to go around the ears at night time, just to protect them a little bit from the pillow. But no dressings are required during the day. It's a good idea to avoid strenuous activity, gym work, hanging upside down, anything too vigorous, certainly for maybe 2 or 3 weeks anyway. afterwards. And certainly avoid, contact sports, rugby, judo, things that are going to potentially traumatize the ear, because if the ear gets pulled or traumatized during that initial 3 months post-operatively, there's a good chance that the sutures that are helping to anchor and hold the ear where we want it could give way and then end up giving rise to recurrence.
Okay, well, thank you very much for that. Right, next up onto eyes. So this question that came more of a statement: I have saggy eyelids, help. So what could be done for something like that then?
Well, all sorts of things, and actually, the eyes are one of those areas that's sometimes in advance of the rest of the face in terms of the aging process. And with more and more people now online, like we are just now, people are becoming much more aware of their facial appearance and being less discontented. But what's important to establish is exactly what the underlying problem is. It's important to know that there isn't an underlying eye problem or a problem with the actual mechanics of the eyelid function in terms of what we call a true ptosis, or what we call eyelid droop. So if the eyelid actually droops down and starts to come down over the pupil, that's a very different condition to the more common problem of what we call blepharochalasis, where there's a redundancy in excess of the skin of the upper eyelid particularly. And that's very common, and that's much more easy to treat. Ptosis surgery, where the eyelid has truly drooped, that requires a specialist that tends to do ptosis surgery. But the upper eyelids are the most common target for surgical rejuvenation within the face, and it's about very carefully tailoring, removing the skin that's redundant. It's also vitally important that you do assess the patient very carefully, because there are other things that can influence the appearance of the upper eyelid, and that in particular includes the brow itself. And we sometimes see this when there's been over-exuberant Botox and neurotoxins used, because if the elevators of the brow are allowing the brow to droop down, then the upper eyelid can start to be a bit more crowded, and can make it look a bit more conspicuous and hooded. But it's usually the eyelid itself that's the main issue, and it's one that's pretty straightforward to sort out if done carefully. But like all things, there are small risks associated with surgery. Upper eyelid surgery is very readily done under local anaesthetic, in fact. It's day case surgery, but there are some small risks. Infection rates with eyelid surgery are very low. We're very meticulous to sort any bleeding, and usually there's virtually no blood loss at the time of the surgery itself. But we have to be very meticulous and careful with management of any of the little fat pockets that are around the eye, because what we don't want to do is get any bleeding around the eye in the post-operative period, because that can be an issue, because it can press on the eye. It can compromise the circulation to the eye, and in very rare circumstances, it can even lead to visual loss. So these are risks that we counsel everybody about. Thankfully, they're extremely rare. But it's a cliche. You have to go in with your eyes open when we're talking about these sorts of operations. And Jill was mentioning earlier about injections for the nose and for around the eye area. This is a real minefield with the number of people with pretty much no qualifications injecting fillers around the facial areas, often with sharp needles, because if it's inadvertently injected into the vascular system, it can end up leading to blindness, to tissue necrosis, to scarring. And there's been a lot of talk about that in the media recently about regulation.
Yeah, one of the so I've had upper eyelid surgery. I had it a couple of years ago with my own team. I did a video diary that's in facial group, one of the private facial groups, But one of the things that people usually ask us is, what age can you start looking at this from? So I'm 30 now. I think I had it when I was about 35. But we do see people younger. We do see people a lot older. One of the things that Will would talk to you about in consultation, or any of the surgeons would talk to you about in consultation, is what other non-surgical treatments have you had? The current trend is this fox eye thing. So a lot of the guys just wouldn't recommend having upper eyelid surgery within a certain time frame of having the fox eye lift or under eye filler or Botox, because they want to see the natural position of the eye before they get in there and start operating on it.
Yeah.
When the people maybe fib a wee bit about when they last had Botox, but it's really important that you tell your surgeon the truth, even if that surgery a wee bit, because ultimately you're spending a lot of money. You only want to do this once. You want to get the best outcome the first time.
Yeah, absolutely, 100%.
Certainly, fillers around the eye can endure for an awful long time sometimes. I mean, we tend to suggest that fillers may last for a year or possibly two, but you know, there are certainly well-documented cases of filler lasting over a decade in certain parts of the face.
Yeah.
And sometimes it can cause, you know, grumbling problems with you know, some soft tissue swelling, fluid swelling, and it's because a lot of people injecting fillers are injecting very big volumes, whereas often you don't need big volumes to make appreciable changes.
Yeah.
Remind me to come back to another service that Will offers, and most plastic surgeons will offer, fat transfer. I don't know if any questions about it, but it is an alternative to filler.
Right, okay. I'm going to note that down. Okay, right. That's really interesting, and again, just heart.
It's fantastic, by the way.
The fat transfer.
I think fat transfer has got so many applications within aesthetic and reconstructive surgery.
Tell us about it now.
Well, we use it in reconstructive breast surgery. It can be used to provide breast augmentation. It can be, I use it almost as a standard as part of facial rejuvenation surgery, because part of the aging process, and the aging process is a complex one. It doesn't just affect your skin, it affects all the tissue layers. And as we get older, some of the characteristic features are you tend to deflate, you know, your soft tissue volume, particularly in the mid facial area, you know, tends to kind of become more sunken, and that makes the eye bags more conspicuous. And if you can restore that volume with your own tissues, it's a really helpful thing in terms of adding to the rejuvenative process. Because with facelifting surgery, you know, the area that's least affected by facelifting surgery tends to be the central face. It can really be very helpful for the jowls and the neck and things, but you know, fat transfer has really come into its own with helping to restore youthful volume to the mid face. And the other thing that is good with fat transfer is that fat tissue is actually quite a potent resource for stem cells, which are kind of rejuvenative in their own right. So they can be quite a helpful addition to many, be it lower eyelid surgery or facelifting surgery. I've been doing some fat transfer today for helping to restore better contour to a cheek in an unfortunate lady that had really very severe acne, with very indented and depressed scars on her cheeks. So we were helping to release those scars from where they're kind of bound down, and then really filling in with a thin layer of fat transfer and helping to restore some volume to hopefully give her a much better, smoother cheek.
We never have thought like that was even possible. So whereabouts in the face then could fat, because could it go anywhere in this kind of middle bit then?
Oh, you can put fat anywhere. It can help rejuvenate for hollowing of the temples. It can be fabulous for restoring volume to the mid face. It can be used for very hollow upper eyelids or the brow area. you can use it for lip volume. It can be used around the nasolabial creases to help improve those, and also to restore, cheek volume and accentuate the malar prominence of the cheekbones.
Yeah.
So it's pretty versatile.
Laura, me and you have spoken about this. I'm not going to lower the tone in this one because we're talking about faces, but there is another area that fat transfer can be used for. I'm sure I'll get Will back on to talk about that.
Interesting. Who knew? This is so interesting, guys. Right, okay. So next question up then. So you might have actually answered this, Will. Can your brows drop to give you saggy eyelids?
Oh yes.
Yes.
Absolutely, 100%.
Okay.
And it's part of the natural, gravity is the enemy with the aging process in all respects. And we talk about the face going from a triangle with its point at a triangle in that direction, it then becomes a triangle in that direction, with everything going down and the jowls forming. But certainly the brows can drop, and they can certainly have an influence on the upper eyelids, and there are ways to try and restore a better height to the brow, and in fact probably a reflection of the challenge that it is that there are several hundred different described techniques for lifting the brow, and ultimately sometimes the most straightforward ones are the best, and direct brow lifting, where you actually remove some skin from just immediately above the brow itself to help lift the brow, it often has the most direct effect, but it's at the expense of a little fine scar that runs just along the top edge of your eyebrow. But there are many other techniques, including trying to use sutures to help hitch up the eyebrow through incisions in the hairline, for instance. But endoscopic brow lifting, where you use cameras through some little incisions further up in the hair, was very popular in the 90s and the early 2000s, and it's very much dropped off in terms of popularity because the effects were not necessarily that enduring. But there's lots of different techniques.
Well, what would you say your opinion is on thread lifts? Because I know that usually when people are talking about lifting the face in these areas, we mentioned those fox lifts. We don't offer that.
So listen, thread lifts are quite interesting, and it's not something I have done or have been trained in. The technology for these types of thread have been around since the early 80s, in fact, but it was only in the kind of 90s and early 2000s that the actual physical threads that grip tissues were actually used for trying to recite and lift facial tissues. Again, it's been a focus in the media very recently that people are going on a one-day course and then trying to lift, doing a non-surgical facelift, and you think, how on earth do these people have any idea about facial anatomy or what important structures they're right next to? Certainly my feeling is, whilst I haven't been doing any silhouette soft or any other thread lifts, I have seen patients that have had them. They're often quite disappointed with the duration of benefit, and I have actually seen a number of patients that have had problems from them, including facial scarring, that have required surgical revision, and so it's something to bear in mind.
One of the reasons I speak about this, again, like, I've tried different things. I've tried liposuction to this area. Before that, I had done the silhouette soft deadlifts, and I had it with a really experienced plastic surgeon who used to be part of my team, and it was done in conjunction with one of the trainers, who's one of the lead people in the UK for doing these. I had 3 threads put on each side. If I was paying for that, it would have been thousands of pounds. I seen an initial result, maybe lasted about 3 months, and then nothing. It just all seemed to collapse back down again. And I was young at the time. I was in my early 30s, so I should have been an ideal candidate.
Still young. You're still young.
Too kind, Will.
Yes, still young, 100%.
No, it's really interesting because when you get something into your head, and for me it was this bit in my jowls, and I've spoken to Laura about this before, and it bothered me because I've been a weight loss patient and things like that before. So you start trying all these non-surgical things. I've done silhouette soft, that didn't work. I did face and neck tight, that was a wee bit better. For anybody that tells you that's a non-invasive, no downtime procedure, no, not. Again, thousands of pounds. We don't offer that, so read into it as you will. I considered having liposuction and Renuvion, which is probably the next thing that I will try before a facelift. But of my guys at Cosmedicare, none of them will offer me a facelift, and I'm quite persistent.
I can imagine, Joe.
Yeah, none of them are doing it. So you really need to question if you're going and you're paying for a consultation somewhere. Our consultations are free of charge, but that's beside the point. If you're going and you're really not at that stage where a facelift is going to be of benefit to you and give you the longevity, seriously think about not doing it, because where we've seen facelifts go wrong in the past and other people, and we were on the Kay Adams show about it a couple of years ago, and with a very lovely lady who'd went to a great non-surgical clinic in the city that had a surgeon coming in and doing these. If there's not enough for them to take away, it can effectively burst open, and if that bursts open, all those scars are ripping right down here, and it can be a disaster.
Yeah. Oh yes, be careful, 100%.
You can get repeat facelifts, though.
You can.
Don't forget that. So whilst you wouldn't typically see patients seeking facelift surgery until they're well into their 40s, or sometimes a lot older, facelift results can actually be very, very powerful in that slightly younger age group. The 40 plus. Generally wouldn't be considering facelifting surgery at Jill's tender age. But and the effects from a facelift are long lasting. They don't halt the aging process, though. So the process of aging will continue, and we know there are so many factors that play into that aging process, which include your genetics, and some people are very lucky and some aren't. But being careful with sunshine exposure, avoiding cigarettes, these are all crucial things. Eating well with a good diet, all of these things are good general measures to just try and ward off the aging process.
Yeah, absolutely. Okay, brilliant. So the next question, guys, is can Cosmedicare advise on types of brow lift surgery, techniques, etc., done with forehead lowering? Also, can they advise on hair transplant technique for eyebrows replacement? I have none, not that I overdid them. I was literally never blessed with any.
So we do have a hair transplant specialist who treats males and females. He's a very popular provider across a lot of different age groups, so males and females. Something a lot of women don't talk about is even from an early age, their hairline can start receding back. So whereas usually you'll see people like Wayne Rooney going for hair transplants and things, it's actually quite common amongst the female population as well. You can also get a treatment called PRP, which encourages stem cell growth of the hair for restoration, and that tends to be quite popular amongst people who don't have such bad hair loss, or have maybe been through other medical treatments that have impacted on their hair growth. So the hair transplant, that's the first thing. It can lower the hairline, which wasn't the question, but it is potentially a solution to the problem that person's having. That can also be applicable to the eyebrows. So the exact same way in which the hair is taken from the donor side to the back and implanted into the eyebrow is the same as how it would be implanted into other aspects of the head, really. In terms of the brow lifts, that's really Will's area because there's so many options.
Yeah, as we were alluding to earlier on,
yes,
there are many different techniques, and it's a case of coming to get an assessment and discuss what might be the most appropriate option
Forehead
for that individual.
something else that we'll probably be able to give a better answer to. It is a possibility. It's quite complex surgery. It's not a very popular request.
I missed that, Jill. What was that you were talking about?
Forehead.
Uh-huh.
So lowering of the hairline.
Yeah.
For me, that tends more from our trans community, and they tend to come seeking that as part of a facial feminisation package, similar to what your previous trans patient had asked about, the facial feminisation of the nose.
Mm-hmm.
There's a lot of different options available for facial feminisation, and lots of different demographics of society. Some of it is usually factored into the NHS transitioning pathway, so it's worthwhile looking at that. And similarly, as Will was talking about facial fat transfer, that can be a really good way of feminising the face through volume. So all these things are really worth looking at if you are looking at a gender reassignment transitional programme, looking at what procedures can be combined at the same time and what is going to give you the maximum benefit for the overall aesthetic appearance. Instead of looking at your face as just one area that you're concerned about, look at the whole picture. Mm-hmm. And a lot of times, the inverted filter on Instagram is one of the things that I say to people. What you see is not necessarily what other people see. So you will scrutinise yourself beyond belief, whether it's acne scarring or your ears, or I do it with my skin. I've had eczema my whole life, and well, I'll tell you, when I'm nervous, I pick at this ear something awful. I've got this running joke that the hospital's cost me an arm, a leg, and half an ear because I've been so stressed I keep picking at it. People don't always see the same as what you're seeing, so it's really helpful to get honest input from friends and family members.
Yeah.
And friend and family member, what I would say to people is be constructively honest. There's no point saying to your child or your friend or your partner, oh no, you're being daft. There's absolutely nothing wrong with you. If that is something that's mentally and in terms of confidence affecting someone, and it is something that you can see, it's okay to say that, but say it in a constructive way that's supportive, opposed to a negative way that's a critique of somebody's appearance, because nobody likes that. That's not helpful to anyone.
Yeah, we do it to ourselves enough, don't we? That's the thing.
Yeah.
Okay, brilliant. Okay, so this is the last question on the eyes then, guys, and then we're moving on to face, if that's okay. So eyes, I have bags under my eyes which never seem to go away. They're worse when I'm tired. My friend told me there are facial surgery options available for this. Can you tell me what they are and also what the expected outcome is after the procedure?
Again, definitely. And lower eyelid surgery is a very popularly requested intervention. It would be called a lower lid blepharoplasty, and how that's performed can vary. There are, again, a number of different techniques. It's all about tailoring what's done to what is required to get the outcome that is desired. But with the lower eyelids, and she mentioned kind of eye bags and tiredness, what tends to happen is that as the aging process progresses, a number of factors, the loss of fat underneath the eye can accentuate that lower eyelid tear trough. The supporting tissues that help to retain the little fat pads that sit underneath the eye, they can often become a little bit slack, and the eye pads bulge forward, and that's what's producing the actual eye bag. So surgery is designed to help carefully reduce those eye bags, to tighten the tissues. As I say, oftentimes we will help restore volume to the face with fat transfer at the same time. I tend to prefer doing my lower eyelid surgery under a full anaesthetic rather than under local anaesthetic, but it can be done under local anaesthetic even, and it's often very well tolerated. But again, it's about assessing the patient, understanding their expectations, and tailoring what's done to meet those. And as I say, there's a number of different techniques.
Okay. And
again, a number of risks associated with surgery too, as we mentioned before.
Another thing that I would add on to that, we get some people come to us and they think they need lower blepharoplasty. because of the darkness under their eyes. First and foremost, and it's never what anybody wants to hear, but water intake can cause that, and lack of sleep and stress, and particularly in people that have got stressful jobs or they've got kids and things as well. So it's always worthwhile looking at that first and foremost. Then within the Asian demographic, we tend to have particularly Asian men coming thinking that they need a lower blepharoplasty because of the darkness under the eye, and that's not really what's needed. That can be treated with non-surgical options, and can help with that. So it's worthwhile really seeking out advice from people who are informed in all aspects of what's available to you, so that you get the right solution to you and don't automatically jump into a surgical option.
And sometimes alternative approaches can be very effective for the eyelids, that can include, fat transfer. Also, laser tightening of the skin can be really useful in the right patient, and that can affect and improve, sun damage, sunspots, wrinkles, complexion issues. And it can be a very helpful rejuvenative intervention in its own right.
We should probably mention the laser a bit more. As Laura said in the introduction, Will's one of the laser leads at St John's. I think he is the laser lead. He's our at Cosmedicare, and also at St Helens as we go into the hospital as well. And I think we made all Will's Christmases at once when we gave him a CO2 Synerin Candela laser, which is like the best laser available in the market. I mean, his eyes lit up when he seen that.
It's a very good laser.
Yeah, definitely something excited. I was like handing the guy a keys to a Ferrari. He was delighted. He's very well versed in integrating that into treatment care options and trying to avoid people needing surgery in the first place.
Yeah. Okay, that sounds, it's really interesting. It's amazing the breadth of stuff that can be done surgically and non-surgically. It really is. Okay, so we're moving on to our final section. This was a really interesting question, actually, because I think probably every single person that watched this show thought the same. Can we talk about the Friends reunion? Have all the girls had facelifts?
Can you tell? That was the question. I saw that question.
Yes.
Well, the important thing is, if you've had a very good and well executed and carefully planned facial rejuvenation procedure, you really shouldn't be able to see very readily whether or not they've had surgery. Problems arise if there are some of the telltale stigmata of a facelift that hasn't been perhaps as well executed. Perhaps the earlobe has been distorted slightly. Maybe there's undue tension on the skin and the scars have stretched. But there's no doubt a facelift does require scars, but we try and put those scars in the most inconspicuous locations and hide them at the hairline, just around the sideburn area and just down around the ear and into the hair at the back for a full face and neck lift. And they often settle extremely well. So if they're looking too good at the reunion, they probably have had something done, but you may not be able to tell. So
my opinion on this, and something that I've spoken about quite a lot, I actually watched a celebrity blogger talking about this the other day, was what in today's society right now is perceived as a surgical intervention. So I mentioned earlier on that I'd had face and neck tight. That is been described as a non-surgical alternative to a facelift. But let me tell you, I will share this video of me having that procedure. I can assure you, surgical procedure. One of my surgeons took his jacket off and came in and sat down and held my hand. I nearly had a heart attack on the table. It was not good. It was not a good experience, which is why we do not offer it. The cannula, which is a rod about that length, sometimes longer, is inserted and it goes down like this. So it's down so close to your jugular that you're scared to breathe. And that was under local anaesthetic. No sedation, nothing.
You're not selling it, Jill. You're not selling it.
The reason that some people take that option, particularly celebrities, is so that when they're asked a direct question by the media, or if they're going to promote beauty products such as natural skincare creams that give them the look that they've had, they can hand in heart, straight face, that's not moving, say that they have had a facelift. So technically, they have not had a facelift. But if you look at what they have actually had done, it's usually a procedure to tighten this area, and then they've had laser resurfacing, or they've had fat transfer. If you think back to Kim Kardashian saying that her bum was her own, yes, it is her own. It's her own fat. It's been taken from every other part of her body. So it is her own, but it has been a surgical procedure that's got to that. That's what cast of friends have done, including the men, not just the women.
So do you think the men have done it as well then?
Well, I was looking at Tom Cruise sitting at Wimbledon, and I thought, I didn't get a very good look, but I think he's had some fat transfer recently.
Yes.
Oh, do you guys like obviously be knowing the signs, and you must look at celebs and just be like, you must just know.
Celebs, I do it in Marks and Spencer's.
You can just tell, right, okay, that's really interesting to know, and interesting to know if it's non-surgical, somebody could say not had one. Okay, right, next question. When would you recommend a facelift over another aesthetic procedure like fillers and Botox?
It's all down to the individual and, you know, how advanced the aging process is, what their concerns are. Certainly, a lot of these non-surgical or less invasive procedures can make significant improvements that will delay the requirements for a facelift. But once you start to get more significant jowl formation and neck problems, you know, it's limited what the non-surgical approaches can really do. And that happens at very different ages for different people, and for other reasons. Jill mentioned weight loss and these sorts of things, and certainly, you know, massive weight loss can be an issue for people because it can be quite an aging situation. You know, when your facial fat deflates and you've got some redundant skin, and you know, that can mean that you might benefit from facial rejuvenation and facelifting surgery at a much earlier point.
My viewpoint on it is slightly controversial, and I know that any surgeons watching this, they might not like the answer, including Will, so he'll close his ears to this one. I think as a female who, like most females, is interested in how they look, and how they look has an impact on how they feel, that's all fine and well, but these things cost money as well. And I think when you get to a point where you're making interventions non-surgically, whether it be filler, the initial cost of those fillers, so you can get what's called liquid facelifts, where it's 8-point lifts, and those can run into thousands of pounds. If you're spending that kind of money and then you've got that constant upkeep, I think that's when you really need to start thinking as well about making a call. What's the longevity that I'm getting out of this, and what is the risk versus the benefit? So yes, look at it from a surgical point of view, and safety and longevity and what's suitable for you as well. But I think we'd be in complete denial if we didn't say the cost comes into this as well. So don't throw your money down a stank trying to get an outcome that you're only going to get from a surgical procedure.
Okay. Right, next question. What if you get a facelift and it's cracking, but then you're left with a saggy neck, so your neck gives the game away? What then?
Well, I think again that's down to planning and selection of the most appropriate procedure. And you know, if you've got redundancy in the neck, you really do need to have a more extensive face and neck lifting procedure if you're going to get a satisfactory outcome. Some people have a very good neck and maybe some jowling and a more short scar approach, limited approach facelift maybe great. But if there's significant changes in the neck, then a full face neck lift is probably what's needed and what should be done in that circumstance.
Yeah, I think it's also, whilst we've got Will here, to be able to distinguish what your neck is, and that sounds like a really stupid thing to say, but we often get people come to us and they're saying they want a face and neck lift for this wee bit here, they're classing this as part of their neck. That's not what I would class as part of someone's neck. I would class this as part of someone's neck, and even like down to kind of here. So it's really important to know about what aspects of your face you're wanting to change. And that's why a consultation is really, really important, so that the surgeons can see you and feel it as well, because it's not just about the visual, it's about the elasticity of the skin. So you might think you need something, but you actually don't.
And certainly the neck can be one of the most challenging areas, certainly with lifting procedures, because the further you are away from where the lift is actually taking place, so in a facelift procedure, that's all very peripheral. You know, the middle of the face and the central neck, that then becomes the bit that's furthest away from where you're trying to lift. So it can be very challenging to get really great results.
Okay, oh, very, very interesting stuff. So this next question is, maybe you've touched upon that already. Well, could you explain the various different types of lifts and what they involve?
Oh.
What's the kind of down? What's the kind of downtime as well?
Broadly speaking, you know, like I alluded to with brow lifts, there are literally hundreds of described techniques for facelifting surgery. Ultimately, the principles are very similar. You're trying to have very well concealed, almost invisible scars for the access. Whilst you are tightening the skin, the most important element of the tightening is actually at a deeper level. It's at what we call the SMAS layer, which is a supportive layer within the face and neck that allows you to tighten and lift the tissues in a more enduring way, so that you're not actually doing the facelift with the skin, you know, the old style windswept look where the skin's pulled so tight that you know, like you're in a wind tunnel. So, you know, the actual name of the technique is not necessarily important. It's just the knowledge that you have to address these tissues in a respectful way, and you have to be doing something to help lift and tighten this deeper layer of what we call the SMAS. And there's different ways to manipulate it and use it to help tighten the neck or to lift the jowl and the face. You could perhaps categorize it in being a full face neck lift, where the scars extend right around the ear and into the hairline at the back. That would be your classic full face neck lift. There are techniques where the neck is not such an issue. You can do what's called a short scar facelift, where the scar is hidden in the hairline at the front and around the ear, but not into the hairline at the back. And that can allow you to access the facial tissues and the SMAS tissues to help lift the jowl area and rejuvenate. And again, trying to employ other techniques can be really useful to help rejuvenate the mid-face, be that laser resurfacing, be that chemical peeling, be that the addition of fat transfer. All of these things, really, they all complement each other.
As a consumer, Laura, you've probably seen like different influencers go to different places and different celebrities. I won't mention anyone. Probably know who I'm talking about because she's been in the papers recently about having yet another facelift. There is a trend. There used to be a trend of people going to Turkey to get their boobs done. Now there seems to be a trend of people going to England to get a certain type of trademarked facelift. So a couple of surgeons down there have come up with some ideas on how they can do facelifts with less downtime and things like that. And I've spoken before about how different facilities require different types of licenses, whether it's a clinic license, a surgical centre license, or a hospital license. And those impact the types of procedures that you can deliver within those settings. So some surgeons have started adapting their techniques to meet the criteria to be able to deliver them in those settings. And then that allows them to offer it at a price point, because obviously they don't need an anaesthetist, they're not needing scrub nurses, they don't need pathology. There's lots of different things that they don't need to do, so they can reduce the cost of those types of things. So probably just since before COVID started, more and more people were coming to Cosmedicare and going, oh, but I can jump down to York or whatever, and there's this guy on Instagram and he's doing facelifts for £3,500. That to me is crazy, because obviously I know the financials that go on behind this. It's part of my business to know what that is. So I know what the surgeon's fees are, I know what the anaesthetist fees are, how much it costs to run a theatre, what the kit costs. You physically can't do it for that price. So corners are being cut to give those facelifts, and it tends to be that the patient goes down. It's a local anaesthetic procedure, takes them about 2 hours. They're really just taking away the skin. They're not doing anything to the tissues underneath, similar to what Will's explained. They're not doing anything to the plasma band that structures the face and all the different aspects there. But people don't know the difference. So they're comparing apples and oranges when they're trying to look at procedures against each other. So it's really, really important that you don't jump into things and really look at what you're getting, because it might look great initially, and a lot of them do. Like I've had friends, I've had people that I know really, really well go and do that. But how long that's going to last, whether it's going to look like that in 5 to 10 years, is completely different.
Okay. That is, again, it just all hails back to just doing your research, doesn't it? And just knowing exactly what it is that you're going in for.
It helps. I want a short scar facelift with fat transfer, Will.
What was that?
I want a short scar lift with fat transfer, just to hear, and a wee bit like that.
My earpiece, something's gone wrong with it. I can't.
Okay.
Can't hear.
He can't hear you, Jill. He's not listening. Okay, brilliant, guys. Right, last question then. What if you hate the results of a facelift? Do you have any way to show clients what the results may be before going for it? So would that be something? Could that 3D scan that you guys have got be used?
We can do that. I haven't done enough in it with that to be able to show somebody realistically and put my hand in heart and say, I think you're going to look like that afterwards.
I've got a suggestion as a cheap way of having a look of how you might look after a facelift, and that is to lie down on your back, looking up, and get somebody to take a photograph of your face.
Well, that's we all take photographs.
Yeah, I know, but we all do that anyway. Well.
Oh, okay. But that gives you an impression of what the facelift procedure outcomes can be.
Interesting. Okay, and
obviously looking at photographs of previous patients. That's another good way of seeing.
And you've got a private face group for Cosmedicare, which we'll post underneath this as well. Yeah,
I'm looking forward to growing. That was probably one of the last of the groups that we introduced, and unfortunately we introduced it right as COVID happened. So, but what I would also say as well, whereas our breast patients and our tummy tuck patients are very, very vocal and very open to showing before and afters and things like that, there seems to be this thing with faces that patients aren't as confident in doing that, because I think it's a lot of women, particularly the Glasgow-Edinburgh divide. The Glasgow girls have shouted about a lot of things. The Edinburgh ladies keep it very, very quiet and low key. You don't know who at the school gates has had it, whereas the Glasgow girls will turn up with a headband still around their head and be quite happy to say, I did this, I went here. Yeah. So I'm looking to encourage people to communicate and to open a dialogue on the facial surgery group. I think it would be really, really helpful.
Okay, brilliant. Guys, thank you so much for taking the time and taking us through all those different procedures. It's really interesting, the breadth of what is available non-surgically and surgically, should that be something that you are looking into. So that's just been really interesting.
Thank you so much for having us, and we'll be back at another point to talk about other Fs, but we'll get to that later.
You will. No, that was brilliant. Thank you again for your time.
Great, no problem.
Will be put on our YouTube channel and our podcast as well, so people can watch in the replay.
Okay, thanks, Laura. You
Fantastic.
Have a nice.
Thanks, Laura.
We'll hear from you soon.
See you later.
Bye, guys.
Bye.